drugs which are given in cases of psoriasis. So we are going to focus on different types of psoriasis and the drugs which are given specifically to them. So to start off with questions, the first question is, in cases of the psoriatic, in cases of the psoriatic arthritis. So in case of psoriatic arthritis, what is the DOC? That is nothing but the drug of choice. The next question is, in case of the psoriasis. So in case of psoriasis, in case of the HIV patients. So what is the drug to be given? So in such a case, the drug to be given is acitretin. The last question we are going to ask is, in cases of the erythrodermic, in cases of the erythrodermic psoriasis in pregnancy. So what is the DOC? That is nothing but the drug of choice. So we'll find out all these answers in this video. So the first one we would like to discuss about the chronic plaque psoriasis. So the chronic plaque psoriasis, the DOC is nothing but the methotrexate, that is MTX, methotrexate. Next, in cases of the erythrodermic psoriasis. So here also we give the methotrexate. Next, in cases of the psoriatic arthritis. So here the DOC is nothing but the methotrexate as well as the apremilast. Then moving on, we look at the pustular psoriasis. So in case of the pustular psoriasis, the DOC is nothing but the acitretin. It is the DOC. Now we look at another type, that is the psoriasis. Psoriasis in patients with HIV. So psoriasis in patients with HIV, the DOC is the acitretin. Then we move on to the other type, that is the impetigo herpetiformis. So what is the impetigo herpetiformis? So here the DOC, that is a drug of choice, is nothing but the systemic CS, that is a corticosteroids. Next one is the cyclosporin. Lastly, the category we are seeing is the type, that is the erythrodermic psoriasis, and this is in cases of the pregnancy. So here what we use is the systemic corticosteroids. So now to answer all our questions. So the first question we asked was, in cases of the psoriatic arthritis, what is the DOC? So in psoriatic arthritis, the drug of choice is the methotrexate as well as the apremilast is the DOC. Next we look at the psoriasis in cases of the HIV patients. So in case of the HIV patients, what we use is the acitretin. Then we move on to the last question we asked. The question was, in case of the erythrodermic psoriasis in pregnancy. So what is the DOC? DOC is nothing but the systemic corticosteroids.